Good morning, all. This is Dr. Sue from Purely Peds. I wanted to talk today about sinus infections. It can be a very challenging diagnosis and can really worry families, as many times they feel that prolonged symptoms in their children are due to a sinus infection. Sinus infections are generally something we consider bacterial when the symptoms are longer than 10 days. And what that means is you've got an individual who has significant nasal congestion, headache, they could even have fevers, they can feel dizzy, they can feel pressure at their sinuses, above their nasal bridge as well as under their eyes. They can have jaw discomfort and swelling around the area where the sinuses are located, which may actually mean more eye swelling. I want you to know that there is no test that tells us if there's a sinus infection. But what we do is we look at the whole picture. And this is something I want you to always do with your child or even for yourself when illness strikes. Children generally don't have fully formed sinuses until they become closer to school age. And even then, they're still forming. So sinus infections are not something that I diagnose very frequently in children. What I generally see are viral illnesses that are taking some time to resolve. And remember, a viral illness can take 7 to 10 days to resolve. And even then, symptoms may not be fully resolved at that point. So we always want to make sure we know how fevers are, how your child is doing with their eating and drinking, how their general activity level is, and how they look on physical exam. And that can also give us a good indication of whether or not we are truly dealing with the sinus infection. I want you to keep the number 10 in your mind, because if something is a sinus infection, a bacterial sinus infection, then you're going to see symptoms that have lasted longer than 10 days. And I had said earlier that viruses can take 7 to 10 days to resolve, and even then they're not fully resolved, but they're heading in the right direction. Sinus infections are always something that's longer than 10 days. If you are on day 3 or 4 of an illness, that is always the worst of it. 3 and 4 for cold symptoms are always where we seem to be the most uncomfortable. Our body's working hard to fight the virus, and we can just feel crummy. There is supportive care. I want you to make sure that you reach out to your pediatricians or your physicians in general to talk about that supportive care. But for children in general, sinus infections are not something we see frequently. And if I see it, I generally know pretty quickly with how the child looks. I've done some testing to make sure it's not COVID or influenza. I want to mention this too, that COVID presents in many people as what feels like a sinus infection. So for any child or adult that's got really major congestion, discomfort, you're just feeling sick, with a lot of pressure up at the sinus area, by your eyes, under your eyes, above your eyes, and at your nasal bridge. Please, please, please do a rapid COVID test on day 2 and day 4. I always recommend 2 rapid COVIDs a couple days apart, because it can take some time to really form the antigen that's going to show positive on a COVID test. I know many, many people that have not turned positive until day 5 and 6. So I tried to kind of use the balance of days 2 and 4 where I recommend a COVID testing being done. Remember, you don't have to do it yourself. You can go to your pediatricians or your family docs as well and get that done. But until proven otherwise, sinus congestion that comes with significant illness, even fevers, sometimes dizziness, you just feel really sick. It's COVID for me until I get a negative test. And, if it's negative and we're dealing with symptoms that are prolonged, greater than 10 days, just really, really sick, little ones, then that's where I really try to figure out, am I dealing with the sinusitis here? But, keep in mind, your doctor is always trying to figure out what's going on, and there are many ways to try to understand why symptoms of illness are occurring. And yes, many times they are viral, and that can be frustrating to families because viruses take really supportive care and time. Patients with viruses can be very hard to find, especially when you feel like your children are getting sick one week after another, such as this year. It's been really a tough year for so many. So I wanted to make sure that we talked about this. I have many families reach out and say, oh, my child's on day 4 of illness. I think it's a sinus infection. So I always try to talk to them about what my strategy is to determine whether it's a sinus infection or not. Some supportive care that can be really helpful are making sure you extract that mucus from your little one's nose, a nose frida, a bulb suction. They're both really wonderful. Little ones can't blow their nose, so they can't get that mucus out. We get that mucus out. Generally, they feel better. You can also prevent ear infections if you do try to keep those nasal passages clear, because ear infections can be due to fluid that's kind of sitting in that area, the eustachian tube between the ear and the posterior throat. So keep in mind that it's really great to get that out. If you can't, then go ahead and just spray some nasal saline. You can get that right over the counter at the pharmacy or the grocery store. And that's a great way to just kind of keep those nasal passages open. Saline is a great way to decrease some of the inflammation as well. So I want you to know that. Ibuprofen is wonderful for anti-inflammatory properties. Lots and lots of fluids. Keep that mucus thin. When our mucus is thick, we have a really hard time clearing it, and that's when we're at risk for other symptoms of illness. So I want to make sure that you know keeping that mucus thin is ideal. Lots and lots of fluids for your little ones and for your big ones. Making sure that we're all drinking well is very healthy for our bodies. But when I see a sinus infection, although for me it's generally for my little ones, few and far between. With my older kiddos, my older adolescents, older young adults, then those are the kids that I always try to make sure that if it's a sinus infection, I do want to make sure I know it and I treat it appropriately and give them some supportive care. But if symptoms are not going on for 10 days or longer, then the likelihood of it being a true sinus infection for any individual is pretty low. I just want you to know that. And again, please make sure you reach out to your doctors for any medical issues, concerns that you have. They, just like me, go through a whole bunch of questions, a whole bunch of thought processing to come up with what could be going on with you or your child. All right, you guys have a great day. Thank you for tuning in. I'll talk to you soon.